All right, we're recording. Good afternoon, everyone. My name is Ricky Telg. I'm a professor in the Department of Agricultural Education and Communication. I'm also one of the leaders of the Outreach Core for the Southeastern Coastal Center for Agricultural Health and Safety, here headquartered at the University of Florida. And it is our pleasure to have you join us today for a webinar. As you can see there on the screen, the title is Evidence-Based Approaches to Support Mental Health in Agriculture. Insights from Florida's Mind Your Melon Farmer Wellbeing Survey. So today's topic will focus on mental health challenges and the growing concern that it is for farmers and those involved in agriculture overall. This webinar will focus on the results from this recent survey conducted to address mental health issues in our farmer population here in the state of Florida. So for those of you joining us for the webinar, please note that if you have a question or comment for our speakers, who I'll introduce in just a second, to place that in the Q&A at the bottom of your Zoom screen there. Chat is disengaged for this webinar. And at the end of the speakers' presentations, then I will facilitate any questions that you have. So don't wait to have your comment or your question placed in the Q&A. While it's on your mind, go ahead and put it in there, and then we will address these questions at the end of the webinar. So with that, I just wanted to introduce our speakers in the order that they will be presenting information. First up will be Jamie Gerrels. She's the Senior Director of Policy and Outreach for the Florida Farm Bureau Federation, followed by Sarah Bush, an Assistant Professor in the Department of Agricultural Education and Communication here at the University of Florida. And finally, Marshall Sewell, who is the founder of Mind Your Melon Foundation. And so with that, I'm going to stop sharing my screen, and believe that there may be, is there slides here as well, Sarah? I think you'll be in charge of that. And Jamie, I'm going to turn it over to you. Thank you for being with us today.
Sure thing. I appreciate the opportunity to provide Farm Bureau's involvement in this very important research. Just to give an overview of Florida Farm Bureau, we are the state's largest general agricultural membership association in the state. We represent 130,000 plus member families. At our core, our function exists to advocate at the local, state, and federal levels for policies and initiatives that benefit farmers and ranchers in Florida. We're devoted to the health, safety, and prosperity of our membership and their businesses and anyone who advocates for agriculture in our state. To help further this mission, we partnered with the University of Florida IFAS Center for Leadership, Marshall and Taylor Sewell with the Mind Your Melon Foundation, and other very important industry partners to conduct the Mind Your Melon Farmer Wellbeing Survey. This survey was done to help us better understand the challenges that Florida farmers and ranchers are facing, and more importantly, to learn about what type of resources that they would be willing to accept when it comes to their mental health. Approximately 1.3% of the United States population is involved in farming as their primary occupation. 1.3% equates to 2 million farmers across the nation. Therefore, we cannot afford to lose them. We want to assist others in getting involved as well. As you know, the word sustainability has become a buzzword in agriculture, and that's often attributed to the preservation of natural resources. However, we must also realize that without the people of agriculture, it would not survive. Therefore, Farm Bureau is committed to the well-being of agriculturalists to achieve true sustainability. Together, we feel as if we can reduce this stigma and ensure that Florida producers can live full, healthy lives. In terms of why this survey was needed in the industry, we know that mental health struggles don't occur in a vacuum. They affect the individual, they affect farm families, the local economy, and also food systems. Over time, that toll can push individuals to leaving the farm altogether, threatening the sustainability of rural communities also as a whole. The survey was needed to bring awareness to the seriousness of this issue, to bring it to light, and to inform decision makers of the specific resources that are needed to meet producers where they are with what they have and what they are willing to accept. The data that we received will allow us to play offense when it comes to mental health. By taking a proactive approach instead of a reactive approach we can help prevent problems before they escalate. The insights gathered from this survey are more than just numbers. They are a roadmap for building the right support systems. This data will be critical in informing programs, influencing policy, and driving conversations on the state and even the federal level. And with this data, we now have the opportunity, and really, we have the responsibility to lead in this space. In Farm Bureau's advocacy and policy work, we often say that policy implementation takes the right people in the right places at the right time to move forward, and that truly rang true in this iconic partnership. The success celebrated with this survey would not have been possible without key industry partners championing the topic and encouraging their own members to participate and complete it. Their efforts in advertising the survey across a plethora of media outlets is greatly appreciated. Florida had this unique opportunity to partner with existing not-for-profits that already had a following and already had a brand, with the availability to advertise it on their own platforms. Fortunately, American Farm Bureau has really taken a lead in this space as well with their Farm State of Mind initiative. And we made sure to take advantage of the resources that we had at our fingertips with American Farm Bureau as well. In Florida, this was the first farmer-focused mental health survey of its kind. And we hope that by our research and our guidance, we can inform and guide other state farm bureaus across the country to execute this type of survey in their own states so that our voice and data can be amplified and compared to other states across the country at the American Farm Bureau level where we can have a greater impact and action in this space. So that gives an overview of Farm Bureau's why for being involved, and kind of the steps forward where we look forward to taking an actionable approach in the future with the results. Thank you, Dr. Taub.
Great. I think we have next up will be Sarah Bush. Sarah?
So I'm here to, get an opportunity to present with you what our findings were, which is probably what a lot of you guys are interested in and kind of those sharing pieces. There are a lot of available resources that we can provide to you of these findings, overview pieces that were, conducted. And there's a lot more findings than what we're going to present today, but I'll be presenting on that behalf. This was the work of Dr. Carrie Baker, who is currently an assistant professor of Oklahoma State University for her dissertation work here at the University of Florida. She really championed a lot of this work. So while I go through the slides and give the presentation, we do want to give kind of credit there to a lot of the statistical work that was done in the background on her part. So looking at kind of our findings here and kind of these executive pieces, it's important to take into account that we had 671 total responses. We thought that was a really good response rate considering the time in which we collected this data. So we collected this data last year in 2024 between September and November. And for those of you who know a lot about Florida, you know that we were hit by 2 major hurricanes within that time and in our data collection period, which did kind of skew and change some of those results of how many we had kind of expected. But overall, we felt like statistically this was a good place for us to be and kind of continue forward for this. We see this as a reliable kind of baseline metric comparison that we can use for kind of future pieces. Overall of our results, the first thing that we found was that stress was moderate and that suicide ideation was low. So, we'll talk about this as we continue to move forward, but we really saw this as an opportunity to look at prevention as opposed to major intervention components for what this would look like in the state, which is one of the things that Jamie highlighted with the need for this to be timely, right? It was timely in the idea that that's where we're at compared to potentially some other states and other national data that's available. Our respondents reported 66.9% of the time feeling sad once, feeling depressed or sad at least once in the last 3 months, and 9% of them did report that they had suicidal thoughts once within the last 3 months. So that makes a little bit of a starting place for us to talk about the rest of these pieces for that thing. So what does this look like? We had 671 responses. You'll see different numbers throughout. That's because the survey was There's no question was required. So we do have questions where individuals did not answer everyone, which is why you'll see different numbers that don't always add up to the 671. So we had 298 males and 246 females complete this survey. The majority of these individuals, or the highest number of these individuals, were farm owners. They could select more than one of these as options. So we had 297 farm owners. Then you can see our next number at 144 was farm managers, kind of followed by industry representatives, farm spouses, then workers, and then extension and other roles that were identified for the participants that we had. Of our representation, we had 383 who were willing to report their county of residence. I will say there were a lot of demographics on this survey. So as we know in this industry, that at times identifying a county on top of what industry commodities you're involved in, on top of your age, on top of your gender, and all these other demographics could indicate for some individuals that they could feel that that made them identifiable, and that may be the reason why we saw a low response kind of here within this county level. But what we were able to kind of determine was that we had 56 different counties that were represented. Only 7% was from the Northwest, that 27 participants that identified there. We do kind of attribute that to this is the area that was hit the hardest with the hurricanes this past year, which could have led to that. And then you'll see that the rest were kind of broken up around the state, kind of a little evenly from what we have, with a little bit more in the Northeast, which probably just has to do with the location in which we are all actively engaged in the places that we ended up kind of being most actively recruiting for individuals. You can see Polk County had the highest responses, followed by Alachua and Lehigh County, and then Highlands and Hardy here. Moving into kind of our results here, we had said that, that we saw moderate perceived levels of stress overall. On this scale that we had, which could range from 0 to 55, we had kind of an average of 23.28. However, we did have a standard deviation of 8.19, which means that there were some outliers kind of within that piece. The next part and this was of Florida farmers. So this information was specifically of those who worked kind of just in farming. We saw that their top stressors were actually a lack of public understanding of agriculture in general, which we'll talk about a little bit as we move forward here. Natural disasters and weather, which probably isn't a surprise to many of us. Balancing home and work life acted as a major stressor, and then that saving for retirement component. Generally, uncontrollable factors and financial insecurity ended up being in our top 10 and kind of ranked there in that next top 5 piece overall of top stressors. Looking at the sadness and depression, we did again have 67% who said that they felt sad or depressed at least one or more times in the past 3 months. And then that 9% that had thoughts of dying by suicide at least one. 2.8% had experienced suicidal thoughts at least once or more within the past 3 months as well. So, that did tell us that there is a baseline for considering this, and even 1% for those of us who are working on this is too much in this area when we think about that suicidal component. So we'll hit upon what that means as we move forward too. Coping mechanisms. We wanted to see what people are doing to cope. What are they doing to, handle some of this? We all have stressors, right? Moderate stress is not that unusual for many individuals, but what are the coping components that individuals are using in this area? We found that overall positive coping strategies did rank a lot higher. So we had a lot more individuals that F identifies frequencies, and then the percentages of individuals who were saying praying and participating in religious activities, listening to music or podcasts, engaging in a hobby, exercise, or going for a walk and watching television were those top ones. And then also the negative coping strategies, our 2 highest were actually drinking alcohol and then overeating or turning to food. And you can see that, underneath this, those other negative coping strategies actually dropped pretty low. So, 24 is the next highest with, marijuana and cannabis usage. However, we did have some people who answered with some open-ended responses, and some of the ones that were most common that we thought were important to note here because they weren't questions that we had asked, but several people did respond with, was this idea of a potential negative coping strategy being kind of doom scrolling, but also, taking a drive or doing nothing. Taking a drive can be positive coping strategy a lot of times, but that doing nothing could then fall kind of into, the eventual category of dropping further in mental health. So those were kind of some interesting pieces there. Task related, some described using working or organizing and doing yard work, something to distract them as a coping strategy. And then they specifically pointed out some of these health and wellness, yoga, weightlifting, cold plunging as things that they do kind of in that area as well. As we get into this a little bit more, we then started to ask questions about whether or not they would or wouldn't use services and what that looked like. Specifically, when asked about general service youth and meeting with a mental health professional, we did have 44.8% who said no, and I don't want to. So they would not, take advantage of that resource. We did have, several though as well, 7.8% who said no, but I would like to. And then we did have a pretty high percentage here between yes, regularly for at least once a month at 21%, and yes, once or twice at 26%. So we still did have a pretty good mix here, evenly of about 50% of those who are willing and using, or, kind of those who are not willing or using. But that 44.8%, I think, is still something we want to concentrate on as we continue to kind of move forward with that. The next piece here that we saw was, we looked at the resource access for what could be causing some of these stressors or what could be things that could be needed resource wise. And it didn't just focus very specifically on mental health resources. It talked about a lot of resources that do cause, mental well-being concerns. And, some of these are access to basic life components and insurance and things like that, which do impact well-being overall. So what we're seeing kind of from this area is their accessibility. Most had accessibility to a place to buy groceries, but still not all. However, we saw our lowest accessibility was for in-office routine medical care visits, telephone and online access to mental health, in-office visits and mental health professionals, and then also community-based mental health resources or support. In one of the things in a regional difference that was identified that that access to mental health care was much lower in the Northeast region, even with the smaller percentage of individuals that we had kind of respond. From that, when we looked at types of insurance held by participants, we did see that, car insurance and health insurance were things that most people did have. However, these farm-related coverages were a lot lower for crop insurance, flood insurance, and, disability insurance, which are things that most of our agriculturalists do have kind of influence them, and those insurance things could help them financially in the way in which they're able to recover from those natural disasters that we had identified as one of those top stressors specifically. So, I mean, that comes in as a big piece there, and consideration for access to resources and how that could impact things. We then asked questions about their familiarity with community-based mental health care. We were trying to look at different ways in which we might be able to have access to help individuals through, some prevention programs or intervention. And working with the Farm Bureau, what we know is that many of them have county-based offices across the state. So that's a good opportunity to really locally, do some work in those areas. What we found is that there was very low familiarity. So as we look through these responses, most people didn't know what this was. And this was something that this is kind of one of the first times that they had kind of heard was this community-based mental health care. Their intention to use was kind of mixed. It was really right in the center of a 5-point scale at 2.442. And most people said probably not to probably yes. We didn't have a lot of definite no's or definite yeses. But overall, the likelihood was still, kind of alternated between some things. We saw the things that they were most likely to use. The differences are not that significant, are things related to, recreational activities or practical tasks and things that they could do together. Counseling services through church or clergy, which, does relate to the top in things that they were using as coping mechanisms. Telehealth or counseling consultations. However, if you recall, we just said that that was a lower access point for a lot of individuals, was that telehealth. And then mental health education or awareness trainings. However, what we saw down further was that they really had a lower interest in kind of peer support group or mobile health clinics, farmer-specific crisis hotlines that had a low interest to it, local outpatient mental health services, or these community-led suicide prevention programs, again, also had kind of a lower piece. An interesting piece or look at that we've been kind of considering from the outside is that a lot of the current kind of focus, especially from from a policy area nationally has been, on these farmer-specific crisis hotlines. And at least here in the state of Florida, we saw a lower want or desire for that than we may to some other pieces that may be better from a prevention standpoint. Our top recommendations here overall for the results of our study were really to prioritize, interventions and funding for that prevention component. So look specifically at what the things are that they're doing to cope. How can we transfer those coping structures? We can't ever get rid of natural disasters. I think that we all know that's outside of our realm. We can't get rid of, these financial strains that just do kind of plague the industry. But, things like work-life family balance or setting yourself up financially in a way where we can make insurance more accessible or things on those levels that can lower some of those pieces through prevention are specific things that we could potentially do, or looking at, the intention of increasing and promoting protective behaviors and crisis response related to, hotlines, crisis counseling, and QPR training as a piece. Really leveraging that faith-based connection, prioritizing socially engaged programming was something that we saw as an opportunity. That faith-based was one of our highest coping mechanisms that individual used. And then on top of that, they said that it was one of the top community-based mental health care pieces that they would participate in. So that's an important thing for us to consider. When thinking about policies changing, we really want to think about resources and evidence-informed programming that targets those prominent stressors to kind of help Floridians regain a sense of control. I think this presentation and webinar is an example of this, but really trying to work to increase the public understanding, increase ag literacy, and really engage lawmakers in that process for, engaging that, as that was one of the top things that was expressed as a stressor. Natural disaster and financial insecurity, making sure that our farmers have safety nets and resources, that they have continued supports from groups like this, and increased mental health resources, CEUs for strategy planning, and kind of working through that whole process. We saw creating segmented and tailored based programming on specific demographic groups as an opportunity. It's not highlighted here, but there was some very specific work done that took these pieces and looked at how these groups fell into different categories. And that work by Dr. Baker was able to identify, 4 different kind of distinct groups who may have different wants, needs, or desires as far as what intervention might look like. So some very specific programming for those groups that is tailored for different people to approach from where they are, with work that may help them in that way, was something that we saw as an opportunity to create interventions that offer trialability. So for instance, suggested counseling vouchers so that somebody could go once and not fully invest in what that looked like, but just have a chance to see what it was like, to try to remove barriers. Travel is a big barrier from this, and that accessibility was a part of that as well. And then also just to foster return to counseling and kind of helping to overcome those initial barriers to help seeking could be an important part of this. Expanding the telemental health infrastructure, especially in North and Central Florida, where we saw a lot less counseling centers, and accessibility to that is a big opportunity here, to kind of, meet people where they are. And oftentimes telehealth have very different hours than what in-office visits do as well, which does also help to kind of provide some different ability for farmers to meet at times when maybe it's better for them to not be out in the field and doesn't take away from their work day. Educational efforts to raise awareness for regional and community-based resources that could benefit farmers. I think with the low amount of individuals who were even aware of what community-based mental health care was, we saw an opportunity to kind of expand that educational and knowledge component, and then also to just have more community-based resources. And then finally, we saw this overall as just the ability to develop a longitudinal baseline. So repeating this well-being study in the future to kind of see where we are, a few years later, how we track from this initial piece is definitely an opportunity that was identified by this team in this group. And it's time to hand it over to Marshall.
Great.
Thanks, Dr. Bush. And thanks, Jamie, for your introduction to kick it off. And then Dr. Bush for everything you added about the outcomes. And also just want to start off by thanking everybody who's attending. Appreciate your interest in the topic, in the results from the survey. And I hope that at the end of this, on top of just getting even more knowledge and background on the study and the work that we conducted, I hope that it will compel each and every one of you to realize that this is very much a real and prevalent issue in the industry, not just in our state, but regionally, nationally, and even globally. And there's more work to be done. But for my portion of this presentation, I'll just point out that Dr. Baker and Dr. Bush asked about just giving a little bit more background on how it came to be, and then what our organization intends to do with some of this research as we move forward. So I won't read through all the words or anything, but you can take a glance at those. But this is an early picture of our initial group of board members. So it's the foundation has continued to grow since this picture, but I thought it would be fitting to share that we like to say that we started out small and mighty, just a group of people who all had lived experience, our own personal ties to the topic of mental health within the ag industry. And we knew that it very much needed attention. And as you can see, based on the mission and the vision, we want to bring light to this topic. And we want to do that, especially through research, advocacy, and outreach. Now, research is not my forte. I don't have a wild academic background. I'm not a researcher or clinician or anything, but fortunately, we've been surrounded by some wonderful people throughout this project. And I point out that research has been a big part of our efforts through the Your Melon Foundation, because we know that we've been reminded constantly that we measure what matters. And so we knew that this topic of farmer mental health, farmer well-being, and even farmer suicide, we needed real metrics. I'll tell you a little bit more about my own personal tie to it on the next slide, but I'll just start by saying that within the Your Melon Foundation, at this point, we've advocated on this topic of farmer well-being, not just within the state, but across the United States and even within other countries as well. Our organization has done that through keynote presentations, through workshop facilitation, through various digital media platforms, and then also guest writing, guest lecturing. And then Dr. Bush, if you want to go ahead and advance to the next slide. For the, oh, go back one. For the actual history on how this all came to be, I'll start with that left-hand side picture. That's actually myself, my grandpa, my dad, and my brother in that one single picture. This is from around 2007 or so, 2006, 2007. That's 3 generations from our family farm. My grandpa's 3rd, my dad 4th, and my brother and I 5th. Grew up in Plant City, Florida, raising strawberries and mixed vegetables on this multi-generational operation. And as many of you well know at this point, or maybe you don't know, that's why we believe that this whole mental health and well-being topic within agriculture can sometimes be so much more complex. Yes, we all face stress in all professions, all fields, all day-to-day life, but we see farming and our involvement in agriculture as much more than just a job, as much more than just a profession. It's an identity. And it does come with so many factors that, as Dr. Bush pointed out, that we saw within the top stressors, so many factors outside of our control. So they all end up feeding into this system where within other fields, we often refer to it as cumulative stresses. Sometimes these things build. And then within our operations, we like to say that in farming and ranching and agriculture, we work 24/7, 365, no off days, and we take work home with us at the end of the day. And the specific story and incident that really was the catalyst for our family's work with the Your Melon Foundation actually goes back to my senior year in high school. We were getting ready for our strawberry season. And as we had all of our plants in the ground right before our early harvest, we faced a major crop failure and lost a significant portion of our strawberry crop before we even began harvesting. And it was at that point that, while our family was starting to see all of the bills come in, and we realized that there would not be any checks coming in, my dad, as you can see in that picture, a gentleman in the plaid shirt on the right-hand side, he ended up making the ultimate decision to take his own life. And for many people, that is kind of the end of the story. And we do not look for any sort of pity or any sort of sympathy. We just know that on the back end of that, there was the grieving process for our family. But on top of that, there were my brother, my mom, and myself, and my grandpa, who were all trying to figure out how to grieve the loss of my dad while navigating the crop failure and trying to preserve the family farm for future generations. Very complex indeed. And on top of that, the stigma around mental health and around suicide continued to linger. So many people in our community knew what had happened, and yet so few people were willing to talk about it and address it. I personally sat with that story for almost a decade before having the opportunity to speak about it. And Jamie mentioned earlier about Farm Bureau's involvement. in this space. And I'll echo that. It was actually a Farm Bureau organization that reached out after a hurricane. It was Georgia Farm Bureau. Hurricane Michael had gone through the Panhandle in South Georgia, had really impacted a lot of operations and a lot of families. And Georgia Farm Bureau reached out and asked if our family would be willing to go and just share some testimony and share some stories with their membership, and decided to do that. And since then, it sort of snowballed into a scenario where all sorts of people began wanting to reach out and share their own stories. And we realized that this was not something that was just relegated to our own family. It was impacting so many people in so many areas, in so many walks of life, and yet nobody was talking about it. Now, on the right-hand side, you'll see the picture of my wonderful wife, who unfortunately was not able to make it on the call today. She actually had another event, but she's been a huge catalyst in this process as well. And she has been right alongside me in forming the foundation. And you can see that we're sitting on that couch in front of some microphones. And part of our outreach started in the form of a podcast. The Mind Your Melon podcast was one of our earliest efforts, where we decided that we wanted to do two things. We wanted to share stories from the field so that we could provide an additional voice for people from within agriculture to talk about these issues that they're facing, these challenges. And that was a twofold thing. We wanted others to realize the reality of the issues that they're facing. And we also wanted to build more community around these agricultural voices and the things that they were facing, as an effort to start destigmatizing some of the topic. The other thing that we wanted to do was provide a platform for potential resources that might be helpful or beneficial to people in the ag community. So that has been one of the earliest efforts behind the foundation. And then if we move to the next slide, I'll tell you a little more. Something else I'll point out before I even discuss any of the words on the left-hand side around our efforts and our strategy moving forward. But on the right-hand side, you'll see the roadmap. Doesn't look like much of a map, right? It's all over the place. But I think within mental health and within suicide prevention, what we've learned is that so often we want to look at things as linear, or we want to place things in nice little quadrants and nice little buckets. And what we have seen anecdotally by working with people directly in the field is that mental health is right in the middle, and there are so many roads that lead to it. There are so many of these stressors and these complexities that people and their families are dealing with. And at the end of it, we all arrive at this issue of mental health. And for a long time, what our family has witnessed is that work in this space ends up kind of being defined by crisis hotlines or suicide call centers and things like that. And what really motivated us to start expanding our efforts with the Mind Your Melon Foundation and bringing on this board of people with various lived experiences and backgrounds is that we really wanted to start focusing on 3 Ps: proactive, preventative, and protective. So rather than just looking at symptoms and trying to catch people at the very end, we wanted to start really looking at some of the initial stressors and how we could help mitigate and manage some of those. So I'll share just a little bit more about the areas of effort, and then I believe we'll have plenty of time for some Q&A. But first and foremost, we want to continue serving within the foundation as industry leaders and thought leaders on this topic. We know that it is now making it onto the docket within so many different agricultural and natural resource organizations in Florida and outside of Florida. But Mind Your Melon does pride itself in being solely focused on mental health and well-being and suicide prevention. So we want to continue sharing those thoughts, being thought leaders, and generating conversation, providing resources for others within the ag and natural resources space. The next point is amplifying voices. I alluded to that with the topic of the podcast, but that's something else we want to do. And you saw that in that top stressor around people being stressed out by this lack of public understanding of agriculture. We know that by amplifying voices, we can continue to build community around all of these shared lived experiences. But on top of that, help amplify those voices for other people who are outside of the agricultural industry, who need to understand what farmers, ranchers, and ag professionals are truly facing. We also want to redefine resources, again, just based on what I mentioned previously about historically it's been so reactive. Jamie talked about that in the introduction as well. Rather than being reactive, we want to play offense. We want to be proactive, and we want to actually mitigate the core stressors or the root stressors, as opposed to just waiting for the symptoms to manifest. We believe that there's a huge need to continue developing local champions, because we need people, as one of my own personal mentors likes to say, we need more bell cows. The bell cows are often the cows that are up front, wearing the clanging bells that lead the herd, and we need more of those types of people. the ones who are willing to step up, who are willing to be vulnerable, who are willing to be a voice in this space. And that way they can help shine a light for others and lead the charge. And finally, that brings us to new peer opportunities and peer trainings. We saw, based on the data that Dr. Bush so eloquently shared, that oftentimes we see that people want to participate in social groups and social outings. There's a bigger demand for peer support as opposed to professional counseling or therapy. But we also need those people to be more confident in having the conversations that a lot of times we shy away from, or that we don't necessarily know how to approach. And very quickly, I'll give one specific example of something that our board has decided to pursue. And we've partnered recently with an organization. It's called Moth and Flame. Happy to share more details to anybody who might be interested. But Moth and Flame is a virtual reality technology provider, and they're currently partnered with the Department of Defense. And they actually create and offer virtual reality suicide prevention and suicide intervention trainings for military communities. And so we will be moving forward in fundraising to partner and collaborate with Moth and Flame, using some of the same platforms and some of the same techniques and technologies that they are currently using with the Department of Defense. We will be working with them to create agriculturally competent modules and training programs where individuals who participate in this 20 to 30-minute situational training will actually be backgrounded on intervention methodology, and then be sitting across the table virtually from a real person in a real crisis, and they will have to have the conversation to intervene and get those people the support that they need. So, Dr. Bush, that's all I had to share, and happy to participate in any Q&A that the group might have.
Great. Thank you so much, Marshall and Sarah and Jamie. So we do have a few questions and comments in the Q&A, and I'll go ahead and read these. And then one of you or more of you might want to respond to the questions or comments. Again, if you're participating as a webinar guest, please feel free to place in the Q&A questions or answers that you have. We have probably about 15, 20 minutes to do this. So the first question was why there were not many farm workers participate in the survey. The response may be quite different from farm owners and management personnel. Did you analyze by their groups as well? Probably, Sarah, that would be to you. Yeah.
Yeah, I can answer that, and then if anyone else has any responses here, I think that's to add in. I think a big portion of that discussion, from our kind of group is we did have this survey available as well, an alternative Spanish version. But as we know in the state that many of our farm workers are of Hispanic or Latino descent, and those individuals, we have to remember kind of what else is going on currently, and their likelihood of response is always a little bit lower, just from even an approach of getting them and accessibility to those individuals, but also the likelihood that they would respond. So oftentimes we end up spending time working more in depth with those communities in order to really access them in a way that helps to meet them where they are. We did meet and discuss with different individuals about ways in which we could approach to get them more involved within the survey, but within the time space that we had from that, it wasn't necessarily something that we could invest in order to kind of meet them where they were within those pieces and get the response rate. So that's kind of what we would attribute that to. But again, it's just a very hard to access population. And again, I think that most individuals who have ever tried to research or work with those groups would also support in stating that. And I think that's what we attributed those numbers to.
Great. Thank you. This next question is, unless Jamie or Marshall would like to add on to that one. Okay. Next question is a little similar in some regards. It says, for your industry and stressor scale, did you subset based on the different farmer subgroups? If so, can you share some of those results? It's very likely that farm owners and farm workers have very different demographics and their work experience and strenuous work.
Yes, I believe I'd have to pull it up. I believe that is in the report, that it is actually, there's two different results sections. We reported the farm worker piece here, but then also we do have the farm manager components, and there were some subtle differences, but you'd actually be surprised that they actually were very subtle. We actually saw, I think, a little bit higher stressors in those that were farm managers and farm owners. And that just relates to overall well-being from, other research also relating to financial strain, being kind of one of those top pieces. They tend to take on the largest level of financial strain in some of these pieces. But they were really not as different as you would think that they would be. There were some subtle differences, though. I can go ahead and pull up the report now, and I might be able to tell you a little more of them. I apologize. I'm not as well in depth at the top of my head with this data as Carrie would be if she was here, because this really was kind of her baby, but I'm happy to go look some of that up so I can answer for that a little bit better. And we are happy to provide you with, all of the information that we have. There's a, wonderful report that was done on this that has a lot of great information in it. So let me go ahead and pull that up.
Great.
I don't know if either one of you guys have anything else to add to that, but that you can think of off the top of your head, but I'd have to go look it up.
Okay, well, while you're doing that, were there any regions of the state that were more stressed or suicidal than others, or any specific area of ag that gave the highest stress results? Any thoughts there?
Stress-wise, it was relatively even around the state. There wasn't a large difference in different areas from the data in which we ran. We actually ran it, though, based on those areas, and I don't believe we ran it county-based, so there may be a need to kind of break that down a little bit more. But there was a difference. There were some significant differences very specifically in the reported components of access to resources that we saw. So again, as we highlighted that, their access to resources was much lower in the Northeast, but there weren't any very specific differences on the stressors within those areas. This is also a ginormous data set, so some of your questions could also cause us to go back and rerun more data, as we are very well aware as a group that there is a lot more to be uncovered in this data set that we have not actually explored to answer some of these different, very specific questions. So happy to go rerun those if needed as well.
Okay. Well, I'll just go ahead and say that, again, if you have a question or comment, please feel free to include those. I'll throw a question out there to any of y'all or all of you. Based on the results and your own experiences related to farmer mental health and well-being, given the results of this study, what are next steps for Farm Bureau, for Mind Your Melon, as well, for moving this, and how potentially attendees and those who would be watching the recording of this webinar might be able to assist?
I'll take that first, Marshall. So from a Florida Farm Bureau perspective, I said before, we're always looking for the right people in the right place at the right time for policy implementation, and that is so true no matter what level of advocacy, whether the local, state, or federal level. I will say we have some of the right people in place in our state legislature that are very cognizant of this issue and very interested in championing some legislative statutes for this, or funding appropriations targeted at this effort for preventative measures. Again, we don't know what that will look like, but I can say that this data will indeed inform that decisions or those programming areas for appropriations in the future, which is very exciting on a state level, that this work will inform some of those decisions. I will say on the federal level, in terms of American Farm Bureau, we are being asked a lot of questions by other state farm bureaus of, how did you do this? What are the tips and tricks that you learned? How can we learn from you? And so we're definitely fielding a lot of questions from other state farm bureaus, which is very exciting. The goal is that other state farm bureaus would, again, levy this survey in their state and us have comparable data across the country. So from state to state to look at the stressors and look at what resources farmers and ranchers may take advantage of in this mental health space, and be able to go for federal appropriation or federal policy and programming in the future. American Farm Bureau is having a lot of webinars just like this one. They're having in-person events at their annual meeting in January that we're being invited to participate in. And And I know Marshall serves on one of their lead committees in this space as well. So we're excited that we're being used as a trusted resource for other states to get involved in this aspect.
Thanks, Jamie. And Dr. Bush, if you were going to add more, I hope I didn't jump in or anything. But Dr. Telg, I would just say I don't want to be redundant by repeating some of the things that our foundation board is moving forward with that I rattled off a little while ago. But I'm going to go back to something that Jamie mentioned earlier on, and it's a conversation that she and I have had quite a bit, and I believe it's worth mentioning here, is that mental health can sometimes seem a little bit like a side conversation with so many organizations and so many groups. And something that I believe is worth noting is that we are at a point where there's so much interest right now in the topic of sustainability, in supply chain assurance and surety, food security, all of these things. And what I think we're seeing in a much larger scale picture now is that if you look at data from the aging and declining population of agricultural industry members and farmers and ranchers, not just in the US, but globally, and you sort of overlay that with some of these other stressors and issues that we're seeing within this demographic, and you start coupling that with the topic of who's going to grow our food, what makes a truly sustainable industry or operation, I think that the human component, that well-being component of sustainability, of regenerative agriculture, or whatever buzzword that you want to use, I believe that we're going to see even more emphasis placed on that. So I would just say for people who might be watching this at some point, either now or the recording in the future, if you're looking for areas to explore, I think you could find all sorts of opportunities to look at interventions and efficacy and effectiveness of interventions and trainings and things like that, but also taking a look at more of those industry-wide or economic ripple effects of something like this. I think that's something else that is also very noteworthy.
Thank you.
And I think within some of the work that, Dr. Baker very specifically is doing in this area, as this is her line of inquiry as well, and some of the work that we've done collaboratively together is we are looking to have some comparison to use in the state of Florida, to do some active work. Unfortunately, when you look kind of globally at some of the work that's being done, we're a little bit behind in the United States with some of the work that's really specifically done, especially compared to Australia and Ireland, and even Canada. They've done a lot of work in this area. They're formulating, Ireland's formulating entire counseling training for mental health professionals to specifically be trained to work with agriculturalists to identify some of those pieces Marshall talked about, the agricultural identity that comes in with that, and the ability to kind of say that this is your full identity, and kind of attach that. So I think what we are looking for was some baseline pieces of where to move forward from here, and how can we really tackle the problem from those underlying pieces. And I think that this has given us a good baseline of understanding of how to move forward with some of those prevention components. And where research and evaluation should go from the area of the university's involvement, really related to the really hard work that Farm Bureau is doing on the ground, and Mind Your Melon. Those work that that your groups and the two of you are doing on the ground is really the most accessible piece for agriculturalists. So that makes a big difference too.
Great, thank you. Sarah, I don't know if you had a chance to look
I did pull it up. So here's where the significant differences kind of lied were found when it came between groups, when it came to perceived stress. So we did find that the perceived stress scores were significantly higher. So I don't have the specific, numbers here, but they were significantly higher for females when compared to males, for those with children in the home when compared to those without, for younger individuals, primarily 18 to 34, and for those who were divorced or separated. When we looked at the farm-related factors, we did find significantly higher scores for those with a farm-only income, for those that were actually living off the farm, and for those who felt that they were frequently unhappy in the role in which they had. So maybe those that didn't feel fulfilled within their role within agriculture. We found significantly lower scores in those in small family farms when related to mid-sized, large, or non-family farms, and those working part-time and when compared to full-time. or those who are working overtime when it came to these pieces. So those were the major differences. We did not see major stress differences between farm workers or farm managers or those, working in different industry-based roles. I think another point that's important to kind of point out from here, what we also know about this industry, is that many individuals did have dual roles as well. So many people who are working and maybe their primary role was they working in industry piece, they go home to a family farm, or they go home to, work alongside somebody whose primary income is that. And I can even say that for the group that we worked, the team that we worked together with, that was the case for many individuals here, right? Where even if their operation is small, they still have a small agricultural operation or are working in conjunction with a family related farm, or through succession planning or things like that. So we just know that industry wide from those pieces, but also, when you look at the demographics, that when you look at the huge piece, most people had selected multiple roles, but they had selected their primary role. And that's what we identified in this, in which we shared.
Great, thank you. Well, we are close to time. I don't see any other questions or comments in the Q&A. Are there any last comments that either or any of the you as presenters would like to share on this topic before we close for the day? It's been very helpful and informational for all of us who are very interested in this topic. Jamie, I saw you're
Yeah,
unmuted.
I was
Go
going to
ahead.
let Sarah go ahead, but no, I would just, Marshall gave a sincere thank you to the attendees of the webinar, and I wanted to echo that sentiment as well. And I want you to know that it doesn't take a large effort like this Mind Your Melon Farmer Wellbeing Survey to make a difference in this space. As the survey and the data proves to us, peer-to-peer, right, is the type of resource that people are desiring when they are facing mental health crises. They really want that peer companion relationship. They want a listening ear, and they want a friend, that they can confide in and talk to. So don't ever think that you yourself can't meet someone where they are and make a positive difference. That is definitely possible. And that's something that Florida Farm Bureau is going to be pushing out in the coming weeks for Suicide Prevention Month, is that everyone, an individual, can make a difference.
Yeah, and I think to kind of expand upon that, Jamie, it was really well said, but a lot of the purpose of this survey was not even necessarily the data. It was that we got people talking with it, right? So yes, I'd say, share the report. If you've seen the report, it is a beautiful report in all its regards. It was developed to communicationally be very pleasing in the outside of how it reads and the information that's in there. But even more important is to even just start a conversation about that piece. And I think what we found through the whole process of, collecting data and being out, we did a lot of tabling. We talked about, getting farmers to respond to things, and those in agriculture sometimes can be scrappy. And that resulted in us, attending as a group, a lot of different places and talking to a lot of people. And I would say when we talk about mental health being something that everybody says is so stigmatized in this industry, I don't think we found that. I think that for every time that maybe we saw 1 to 2 people shy away from our table, or, I can think of Marshall in my mind saying, "Have you heard about Mind Your Melon?" Like this question, there was so many more people who, repeated that with, "This is such important work. Thank you for doing it. I already took the survey. I told my friends to take it." People were just really grateful that the conversation was happening. And I think that felt really promising to many of us that we didn't measure anything regarding stigma in this survey. And much of that was because there's been a lot of research done on that. But I think that we would just say anecdotally in the process that we didn't see as much stigma as people believe exists. If you make people feel like it's a comfortable space to share their story, and Marshall and Jamie can echo more of that. Oftentimes people want to, and they were, I think they were just grateful for that, even outside of the data in which we gathered. And I think that was really valuable too.
Great. Okay. All right. With that, thank you all so much for your time. I'm putting our speakers up on the screen there. Jamie Gerald, Florida Farm Bureau, Sarah Bush, Department of Agricultural Education and Communication here at UF, and Marshall Sewell, again, one of the founders of Mind Your Melon. And so I wanted to also place on here, this is our evaluation link. You'll be receiving this as a participant in today's webinar. Again, we are the Southeastern Coastal Center for Agricultural Health and Safety. Thank you so much for being here today. Thank you for our guest speakers today to provide such great information about this extremely important topic. With that, wish you all a very, very happy day. Thank you.